Hi there, and welcome to Canceling COVID. I'm Tanya Rivens, and I get to spend about 30 minutes, I guess, with you, just sharing information, which is so important to what we're doing here is keeping you informed, keeping you educated, and providing great information as we continue to deal with this issue that just will not go away. We know it's not going away. So it's up to us to make sure that we are doing our part to keep you informed. Now, one important thing I want to say with off the bat is I know it's a little rainy. We had lots of rain here in the city on yesterday and a little damp out today. So be careful as you're out and about because we're heading into the summer season and who wants a summer cold? But then again, you may not know if it's a cold or if even if you're being affected or infected by some other type of virus. So that's what we're here to do to kind of make you aware and take precautions as we pull resources. We call it real talk, real solutions and resources. And I ask that as you hop on, if you would please share the information so that others know that we are here every Tuesday at 11 o'clock. So last week it was election day. Um, can I say I was pleased with some of the results? Hey, that's the power of the vote, and the majority wins. We know overall we are not in control, and that's what really matters. Now, as we talk today, let's start out by acknowledging, which is a real sobering fact we haven't touched on. We've lost more than 1 million people to COVID, more than 1 million deaths. Just think about that for a moment. And by all expert accounts, it was never expected that it would be that number of people to transition as a result of COVID. And that doesn't even factor out what I call the residuals, people that were impacted as a result of what was going on with our hospitals. They weren't able to get in, they weren't able to get the service. That number doesn't even touch on that fact that we lost some great people that transitioned as a result of COVID. And here we are over 2 years later, still dealing with it. So, what are we talking about today? We're going to talk about an update. Dr. Tracia Black, of course, is going to join us and give us some great information, a pulse on what's happening in the community, which is always important to get an idea. And what better person to talk to than Dr. Tracia Black? Also, I've got someone who's still dealing with the lingering effects, who has said, I'll make it my job to have this conversation. I want people to know what's going on. It's important that people take notice. And this person is a believer, a Christian. And I know in the faith community, there's still some back and forth, a little bit of struggling about whether, the vaccine is needed or not. Well, here's someone that's going to share his thoughts and just let it's real. What we're dealing with is real. Now, an update on some of the numbers. As far as the vaccine, as of yesterday, 2 million people have received at least one dose of the COVID-19 vaccine. Of those, over 220 million are fully vaccinated, and more than 102 million have received a COVID-19 booster. So that's great news. The Center for Disease Control and Prevention says that at least 1 in 3 people in our country has been infected, and more than 3 times what was originally thought. So as I see you hop on again, I appreciate you taking the time to join us. I think one of the things that I really want to make sure we emphasize is we've got to take care of one another. We got to make sure that we're okay. We need to share this information. It's nice weather. The rules have been relaxed, but we're seeing some of the numbers start to increase. And one of the reasons what's impacting this are young people. Numbers are starting to go up. Well, they'll be getting out of school soon. That's for sure. But I saw a point this morning, 72% of the new cases that are spiking are children. That's right. So we've got to set up, pay attention, and realize what we're dealing with here. More vaccines are being now offered for our young people as well. Again, we're not here to tell you what you should do. We're here to provide some information so you can make an informed decision as you decide what step you will take next. Shout out to Groundwater Solutions, Dr. Tracia Black, one of our sponsors that's been with us from day one. She'll be joining us shortly, 704-596-0505. 704-596-0505, groundwater-solutions.org. We'll have a conversation with her. She'll give you information about some of the things that they are doing, which is really great for our community as well. So your opportunity to get involved and not just sit on the sidelines. That was a part of a great service on Sunday, and it talked about sitting on the sidelines. Put me in, coach. It's time to get to work, folks. Whatever the case may be, let's get to work and put the work in. Now, the first conversation I have is with someone that I is truly near and dear to me, my family, ministry. And I wanted him to share his story. I had to get him on pre record earlier because he stepped in to help me. But it's a powerful story because he is one of the individuals who did not get the vaccine. And I'll let him tell the story, but he still wants to make sure people are aware of, even after what he's been through, he's still dealing with it. And we call that the COVID effect. So here is none other than, it says Adrian Curry, but we know him as Kenny Curry, sharing his story. And of course, you're outside. I get it. But I've got someone who joined us earlier in the year who shared his experience with COVID. He got it around August or so, and said that he really had to deal with it up until November. But what has struck me about this gentleman, who is a great friend of mine, is he's very open and honest about the impact, but also the lingering effects that he's had as a result of COVID. So, first of all, good morning, KC, Kenny Curry. I call him York County's finest. One of our professional gospel artists in the area, super talented. But, you know, here we are still talking about COVID, and it's been over 2 years. Is that surprising to you?
No, not really. When the pandemic first came out, the scientific backgrounds of it kind of correlated that it would be something that we would be in and out of, just like seasons. But what baffles me on it, we're aware that it's something that we'd be in and out of. Our preparation as a people should be more educational oriented than just a fly by night kind of way we deal with it. We should get smarter and get more more conscious of how to protect ourselves and others with this COVID situation.
Definitely more aggressive. Now, you had quite about yourself, something you totally didn't expect, because you worked out, you were in physically, you were fit, mentally, I would say pretty fit, and yet and still you came really close to, you felt like you came close to transitioning.
Yeah, I mean, it was just pretty much of a wait period. Like you said, healthy, I eat right, and in back of my mind, I thought if I ever got it, it wouldn't be as bad. But nah, you can't really judge it that way. It took me to my lowest. Like I said, I thought I wouldn't make it out. Others were in with me that didn't make it out, and I was hearing about that while I was in. So of course, that played tricks on my mind. Uh,
Right.
but dealing with it kind of educated me on how I should move forward. If I ever came out of it. When I
Right.
got COVID, I wasn't vaccinated, and I know some people have their takes about being vaccinated. I'm not one to push anyone to do anything, but it's just been a difference for me. I feel more safe being vaccinated, fully vaccinated, than I was before. I've been around people that was fully vaccinated, caught the virus, and didn't really affect them as it did me. So I'm thankful and just trying to the mask thing. People don't like it, but hey, in order to protect yourself and protect others, it's a great idea to kind of put that on. We have to find a way to kind of overcome this virus. It ain't going anywhere, so
That's right.
we have to be smart on how we operate dealing with this virus.
So talk to us still some about some of the effects that you're still dealing with. You said August of last year. Here we
Mm.
are headed into June. I mean, that's been a long time. I mean, you're still dealing with some of the after effects.
Yeah, I've been able to work out, get back to working out. Believe in treating your body well. Drinking water. Trying to eat right, working out, but still the exhaustion. I have a two-story house, so if I go upstairs urgently or with some type of increased pace, um, it wears on me. I'm gassed when I get up. Even the COVID fog is real, and most people talk about that. I of course hold many mantles of the workforce, or whether it be music, whether it be running my own business. COVID fog, 4 letter words I forget, you know stuff like that still hits. So it's a constant dealing. um Kidney issues, stuff like that prolong. I was on oxygen, so um, other people may not have kidney issues and stuff like that, but I was on oxygen, a great deal of oxygen, which affects the kidneys as well.
Mhm.
I've experienced things I never experienced after COVID. I was pretty much healthy. Never had any issues like that. So
Right.
it's something to be aware of. You haven't experienced it, and you have an opportunity to protect yourself. Don't wait to after the fact and deal with what I'm dealing with now. Be proactive by doing what's necessary rather than being reactive and doing what's necessary for the
Yeah,
better.
it's like just trying to, as you already touched on, we should be better and more educated as we continue to deal with this. And I think the resources are out there. It's a trust factor, but at some point, when do you say, okay, we've got to do better? And that's a great point. I first of all applaud you for being totally transparent, sharing this message. And you told me that's what you want to do. You want to help people find out and let them know you don't mind being the poster child. This is real. And here we are again. Numbers are starting to spike. And even for our children, I just saw 72% of the cases are young people. And so that's another concern. There are some more vaccinations or vaccines that are starting to get approved for our children. And I know it's a difficult decision. We're not asking anybody to run into this, but we're certainly asking you to gather all the facts. So I want to just bring you on for a few minutes. I don't want to tie you up. I know you're busy working, whether it's your day job, your personal job, whatever, or even doing music. So is there anything else you would like to share? Because I just think your words are powerful and people can really learn from it.
Thank you very much. Yeah, I mean, Pfizer just released the dosage for kids 5 up to 11 years old, and then of course you get the regular vaccine. From what I'm hearing, if I'm understanding correctly,
Yeah.
to school every day. Hey, you have to understand that those kids are being integrated around kids that are, maybe affected by their parents that are going out doing and being around whoever. What it just, it just serves as well to be, like I said, proactive, protect your family, protect your community. Um, we got to do all we can do, and we can sit back and talk about it, be biased about it, but at the same time, people are dying. So I
That's
would just
true.
say call it what you want. I ain't never been scared. So either, if you don't mind, you know, staring at the ceiling in the church steeple, go ahead and be hard
Yeah.
headed. But bro, talking about the size of it.
All right. Kitty Curry, I appreciate you taking the time to talk with us and enjoy the rest of your day. All right.
All
Thank you
right,
so
TR.
much. And as you see, a conversation with someone who is lived through it and find it quite valuable to let you know about his experience. So please take note of that because it is important that we are educated. I can't say that enough. Take advantage of the resources. And one great resource that's being provided is any illness, anything that you're dealing with, knowing is key, whether it's breast cancer or any type of ailment is getting informed. And so it's great to make you aware, which you may already know, but I just ordered mine as well. There are more free COVID test kits for you for your home. This is the third round. The first round, everyone, we jumped on it and got our 4. Well, now you can get up to 8. And trust me, share this information so that you're ahead of the curve when we head into the fall and people are looking for test kits again and they may not be available. Here are some free ones. Go back to covidtest.gov, or you can even do the special.usps.com, covidtest.gov, or special.usps.com, or you can even call 1-800-232-0233, 1-800-232-0233. You can get up to 8 more tests, folks. 8. Let's be proactive. That's going to be what we are going to continue to talk about, being proactive and not reactive or reactionary, but not reacting. Go ahead and order these tests now as we head into the fall. It's summer. It's going to be nice. And actually, it just feels like summer. It's really springtime. But order these tests now and you'll have them for the fall. I cannot emphasize that enough. And as with me saying that, I'm going to go ahead and lead into our very next guest, which is none other than Dr. Tracia Black, who's joining us. She's able to hop on with us, always approved and appreciated. Looks like she's riding. I understand that. Hey there, good morning.
Good morning. How are you?
Doing fantastic. Sounds like you're GPSing as well. Where you headed to?
Exactly. Actually, we are going to pick up clients to get to the office for appointments.
Oh, wow.
Yeah,
See, you got
someone needed a ride, and we worked together with the team. So
well, I appreciate it. So I was sharing, we had Kenny Curry on, and he was talking about, I don't know if you remember, he was one that had COVID from August up until like November. He was not
mhm,
vaccinated. And
mhm.
he came on, I wanted him to come on and talk about some of the lingering effects that he's having of COVID. And of course, we've talked about that as well. But I wanted you to kind of give us an update of what you're seeing in the community. And first of all, let me say thank you. Be careful. But thank you
I'm
for,
not driving. It's
okay.
okay.
Great. But seeing this program still of value enough to still be committed to come on and join us and talk about passing information along to our community. So kind of give us an update of what you're seeing, what's happening right now as we see the numbers start to be on an uptick.
Absolutely. As you said, I see the numbers going up. We're still not at those astronomical rates that we've seen in the past, but what we are seeing are folks in families and workplaces that are showing up positive and spreading it in the circles that they're traveling.
So I had a feeling that we might have some issues with you traveling with the
I'm
moving
struggling
signal.
with
You're gonna try to hang on, but I want you to know you got
no.
business to take care of. So I want to make sure that you're handling your business as well and taking the time to talk with us. So you all are still doing free
Okay.
testing at your location on Reagan Drive.
We are still doing free testing. You just need to call. You can drive up 5104 Reagan Drive, Suite 5. You can call us at 704-596-0505. We are still going out to community events. We are still traveling. We were at a church convention last weekend. So we're still available, and we're still taking the coronavirus very seriously.
So with this uptick, Dr. Black, have you guys received any new information as far as directives of how to prepare or how we're going to handle this? Of course, I know weather is nice. The weather's nice and more people outside, but the fall will be here probably in a blink of an eye, as we know how it goes. Have you all started to receive anything along those lines?
No, we have not yet received any new guidance from the states regarding needs for COVID-19 testing. I think everybody's in a standstill mode because of funding, so it's hard for the state to ask for a uptick in testing when they do not have the funds to support that. So they are very dependent on providers like Groundwater Solutions and Genesis Project to continue to offer free testing, whether there's funding for that service or not.
And speaking of funding, you were on a couple weeks ago. We took a break last week because of election day, and I said again, your vote it matters. Majority
Mhm.
wins, but it's important that people get out and vote. But you had shared with us a program that hadn't done any funding that you could find out, and we talked about getting this word out. Do you have
Mhm.
any update on that at all?
Well, the issue was that the program is called Healthy Opportunities.
Hmm.
And there are 3 large organizations in North Carolina that received $661 million for funding for things like housing, for transportation to medical appointments for folks who don't have transportation, for
Uh-huh.
food and nutrition, and for services to help battle domestic violence. And the issue is that these funds have been delivered to these organizations, but no services are taking place. None of these resources are getting out to the community that really vitally needs these services and these resources. So no, there is no update. We know that the companies are trying. They're putting out information. They're traveling around the state, I believe, trying to connect to grassroots organizations. As of yet, we're still not seeing these services get out though. So call your state elected officials, call your local officials, tell them you need these services, because each of us knows someone who is waiting and hoping for housing. I had 2 folks come to my office 3:30, 4 o'clock Friday needing housing. And so if the funds are there, why can't we have access to them so that we can actually get people into safe dwellings?
And what's the name of the program again, just so people are they can catch on and know what we're referring to?
It's the Healthy Opportunity Program. Healthy
Okay.
Opportunities.
Good stuff. So, Dr. Black, I don't want to hold you too long as we wrap things up. Is there anything else you would like to touch on?
Mm, yeah, I like to announce that we are in the process of becoming state certified as a care management agency or tailored care
Woohoo!
management agency.
Uh-huh.
Thank you. And so let me explain a little bit about what's happening.
Okay.
North Carolina is going to a care management model. That means if you know anyone who is on public assistance and receives Medicaid, in December 1st, they will be moved into a clinical home or a care management home. That means you will be able to select organizations like Groundwater Solutions
Hmm.
to be your care management home. If you can imagine that care management is a place that will make sure that all of your healthcare needs are taken care of, that you have a primary care doctor, that if you have any behavioral health needs, uh, depression, anxiety, trauma, if you have or know someone who's struggling with an addiction, we will manage all of those services for you. In addition, we will be able to address things like housing, nutrition. We're hoping that, we'll be, by that time, the Healthy Opportunities Funds will be flowing the way that they're supposed to. But
Okay.
you will be able to select an organization. If you know, there's some large organizations, again, that will be care management agencies, but you will have organizations like Groundwater who are not as large as those organizations, but are grassroots, who look like you, who know what your needs are. There's some cultural competence. So I
Mhm.
encourage you all to get involved and to make your selections. Because what will happen is if you do not select, then you will be assigned to an organization that may or may not be able to meet your needs. So start doing the research now about what organizations are out there. I'll bring that information to you, Tanya, through this platform if
Okay.
available, if you
Okay.
allow me to. But it's
Absolutely.
very important because historically, what's happening with Medicaid is that, and there have been medical homes for many years,
Uh-huh.
but many Medicaid recipients never select a primary care doctor. They don't go see their doctors to follow up on healthcare needs, to make their crime.
So it sounds like we're breaking up, losing the signal now. There we go.
We
Sounds like
lost the
you
signal.
yeah, fading in and out. But what we'll do is once you get me that information, Dr. Black, I certainly want to share it because again, what you're hitting on is what we talked about. Proactive, being proactive,
Mhm,
making
mhm,
everyone aware of what's happening. And you all are in the process of getting this confirmation or affirmation or certified so that
mhm.
people can select you all as a choice. So let's schedule next week to talk about this in full detail where people can now they'll reach out by going to 704-596-0505, correct?
Okay, I know you're talking. I cannot
Okay.
hear
All
anything.
right. Well, I will. What I've done is I've got your information up. I appreciate you for even with everything going on, taking the time to again stay committed and talk to us. I appreciate you for joining us, and we will get that information out to everyone next week on the opportunity around you all getting certified and selecting Groundwater Solutions as your resource. I see her shaking her head. That means that it is not. She's not hearing me. So what we'll do, I had also prepared for this, is working with Atrium Health. I've been working with them as an ambassador in the community, meaning getting information out, letting everyone know some of the great work that they are doing. And as you are hopping on, you're joining this program. If you share, please put the hashtag for me. Do at Atrium Health, but also hashtag COVID Vaccine Ambassador at Atrium Health hashtag COVID vaccine ambassador and let them know that we are continuing this conversation, making everyone aware about what's happening. We're not going to stop talking about it, folks. I'm working on some other stuff that hopefully you'll have an opportunity to find out about as well. Now, Atrium Health at Atrium Health COVID vaccine ambassador. As we start to wrap things up, I do want to share this with you, which is another promotion that maybe can relate to what we're dealing with in our community. There's a campaign. No one's walking away from what's happening with COVID right now. And here's a campaign that's being sponsored by our Health and Human Services
And
right
I
here in
really
North
didn't even
Carolina.
get sick. The only thing I had was like a slight headache, but then next day I was fine. But if you have children, I can recommend that they get vaccinated. I do research myself to keep myself, updated and educated. You have a lot of fake information out there, so you got to be careful when you Google it. I went and talked to my doctor, and he recommended that I get vaccinated. So I think it plays a big part, especially if you ride public transportation. If you're not sure, educate yourself on it and the risk of not getting it. Let everybody stay safe.
So there you have it. You're going to see more of this happening. It's an opportunity for you to hear from real people that are dealing with real life issues. And that was a father of 2 children. Clearly, public transportation is a part of his routine. And he had some hesitancy, was not interested in getting the vaccine, but he did take the chance and go ahead and get it. And he was talking about how he's happy that he's been able to do that. I mentioned Atrium Health. Helping to get the word out to make sure that you are also keeping yourself informed. And it's so easy, folks. It is right now. Things are going well for us as far as being able to get out. There was a jazz concert in Cornelius on Saturday, and they were blown away. It was packed. I mean, from the front of the stage to the back of the field. And the organizer said, we didn't do anything special. It's the COVID effect. People are ready to get out and get together, and you can't blame them. I mean, it's been over 2 years, but we have to be mindful and we have to continue to realize that this is with us. We just got to learn to manage it. And one way is by being proactive. We also said we'll never do a show without talking about your mental wellness. We'll continue to bring that up. If you feel in some type of way, you're overwhelmed, frustrated, it's been a long season, get out and do some self-care. A lot of people on Saturday out at the jazz concert, the Cornelius Jazz Festival, seemed like they just wanted to get out and enjoy themselves. And I saw a really cool vibe out there. And along those lines, one shameless plug, everyone that was there, come back on September 17th. We'll have the Lake Empowerment Fest, also known as Praise in the Park. We'll be right back out there, and we're looking to do the same numbers. My time is pretty much up with you all, my friends. I appreciate you allowing me to spend this time with you. Remember, please share at Atrium Health and also include COVID Vaccine Ambassador. That's hashtag COVID Vaccine Ambassador. If you have some information or a topic you'd love for me to cover, please email me. Again, we're committed to this. rivenstanya@gmail.com. That's rivenstanya@gmail.com. As always, life's challenges make you better, not bitter. Stay dry as we continue to see this weather happening with us. But most importantly, make sure you be well, be alert, be safe, and check on your neighbor. Did I say, as always, life's challenges make you better, not bitter? Dealing with some challenges right now, and always have to look at the positive side. Thanks for hopping on, everyone. Enjoy your day. And again, thanks for tuning in to Canceling COVID. Take care.